Begin your news this morning right here in Altoona, where last night union nurses gathered outside UPMC saying enough is enough. They're demanding the healthcare system invest more money into training and staffing. The union says the hospital needs to make good on a promise made decades ago, and our Olivia Bosser leads us off.
Overworked, understaffed, now UPMC nurses are calling for change. They say it's not only impacting them, but also their patients. Nurses at UPMC Altoona and local labor leaders rallied Wednesday outside the hospital, demanding the Pittsburgh-based healthcare system make good on their promise to invest more in the local hospital. During a year, UPMC reported an operating income of nearly $350 million in the first half of the year alone.
To the nurses here today and working in the hospital right now, we see you, we support you, and we will not let you stand alone. And to the UPMC executives, hear us loud and clear. Put people over profits, put care over corporate greed, and by God, honor your promises to this great community of the city of Altoona.
The rally comes amid a worsening staffing situation. They say understaffing has led to emergency room wait times that exceed state and national averages. Jamie Balsamo has worked as a registered nurse at UPMC Altoona for over 17 years. She says hospital-wide cuts are to blame.
We get, complaints about that all of the time. But a lot of the problem with that overload in the emergency room is the lack of nurses upstairs as well. So patients end up waiting in the emergency room for nurses upstairs to take care of them. So then it ends up overwhelming the emergency room.
According to SEIU Healthcare Pennsylvania, the union representing the nurses, over 300 nursing positions have been cut, leaving nurses stretched thin.
Med-surg nurses are taking up to 8 patients. Our step-down or progressive care nurses are taking 6. They should have 3 or 4. The med-surg nurses taking 8 should only have 5, maybe. And the intensive care should always be 1 or 2, and they're taking 3.
Paula Kane is a registered nurse in UPMC Altoona's operating room. She says the short staffing is preventing patients from being able to schedule operations in a timely manner, and the situation continues to worsen.
Of nurses in our operating room currently. In the past year, I can tell you probably at least 10 to 15% of our staff have moved on to other positions.
Both nurses say low wages and high nurse-to-patient ratios are to blame, issues they plan to address as the union negotiates new contracts with the hospital this year, with many nurses saying they don't want to leave and feel a duty to serve the community.
I'm surprisingly not from Altoona, but I very much care about the community here. I have children that go to school here, and I love it here. I love my fellow coworkers, and I absolutely love the job that I do. And I stay to take care of the people that come through our doors.
Balsamo hopes the opening of UPMC Mercy School of Nursing inside the hospital helps the current staffing situation, but has concerns.
If we can't keep them, then it doesn't help us in the long run. If it's the same scenario and they come in and get burnout and are given in too many patients, they're going to leave just like they are now.
I reached out to UPMC representatives for comment on the rally, and they told me no one was available to speak with me. Reporting in Altoona, Olivia Bosser, WTAJ News.